Good afternoon. Welcome to the Npath project presentation. My name is Tino Gesualdo, and I'm a full professor at the University of Bari. I will share this presentation with Professor Gallieni from University of Milan, with Professor Dimitrios Goumenos from Greece, with Professor Jadranka Ponikvar from Ljubljana, and finally, from Barcelona, we will have Professor Jose Ibeas. If I can have my first presentation, the introduction, I will, explain to all of you what is Npath project. Well, actually, Npath stays is the acronymous from Nephrology Partnership for advancing technology in healthcare. Is a project that has been granted from the European community. Is an Erasmus Plus that was born because there is a new syndrome in the nephrology field. What today we call this syndrome acute fellowship insufficiency. And if we look at these slides, we should think about it. Being, mentors of our residents, we should ask us why the residents do not apply to the nephrology residency program. If you look this USA residency program, there has been in the recent trend for decline interest in nephrology career, with 51% of programs, 6 out of 134, and 32% of position, 120 out of 374, that are going unfilled in the States. So this is why we applied for an Npath project. Global expert group predicts a reduction in the nephrology workforce over the next decade with potentially serious implication. As you can see, there is a huge difference in the number of nephrologists per 1,000 end-stage kidney disease patient. So this is an important topic that we should discuss together. But multiple factors, we think, are responsible for this, although the reason may vary in different countries. The most important reason, as reported by Sharif in Clinical Kidney Journal, is a lack of exposure to nephrology among students and residents. So we needed, to work at the medical school level and at the residence level. For another important items is the declining interest in nephrology among trainees. So we should ask us, why is it? Maybe in inadequate training, or probably there is also an erosion of nephrology practice scope by other specialties. So the global shortage of nephrologists is failing to meet the growing healthcare burden of kidney disease. As we know that in 1 year we lost more than 1.2 million persons affected by CKD. So we needed to improve strategies for recruiting excellent fellows in nephrology. So we must ensure that those who complete training are highly skilled with expertise that distinguish nephrologists from other specialties and prepared to translate new knowledge into improved outcomes for patients with kidney disease. We need excellent teaching and mentoring that should be the most important factors for the satisfaction of our fellows. And we need to establish collaborative networks to revitalize the joy in the practice of nephrology and convince trainees how exciting a career in nephrology can be. And we needed to develop together. This is why we applied together the people that are today in this session, apply together to the European community, trying, to develop a common curriculum to, let the residents coming in. So all of us needed to build up a better curriculum in nephrology. Manifestation and pathophysiology of renal disease, ACI and CKD should be very well taken. Renal replacement therapy and end-of-life care should be discussed. The residents should be prepared. A sound knowledge of the major randomized controlled trials and international national guidelines in the field of nephrology, dialysis, and transplantation should be improved. Clinical pathological correlation are very important, and particularly we should focus on new procedural skills such as ultrasound, renal biopsy practice, insertion of central catheters, and we need also to develop research facilities. So we needed to train the next generation's nephrology workforce, and our residents needed to become, they like to become superheroes, as they do in the cardiology field, they do in the vascular field, they do in the intensive care unit. So there are new trends in medicine, and we should follow also them because they can become important educational tool. Today, artificial intelligence, augmented reality and immersive reality, simulation and navigation should become in our field. We should apply them to the nephrological field. Now comes Npath. Npath was built on this introduction. Npath is the acronym from Nephrology Partnership for Advancing Technology in Healthcare. This is the first European advanced training course in diagnostic and interventional nephrology. The aim of this course is to refresh the clinical scope of nephrology and promote the nephrology career at the European Union level. It wants to develop a multidisciplinary educational path with patient-centered approach focusing on interventional nephrology. And finally, wants to foster the knowledge transfer between academia and business sector in order to tackle risk management in healthcare. The consortium has been constituted by 8 different universities from Europe: the University of Bari, University of Amsterdam, Prague, Maastricht, Patras, Barcelona, Milan, and Ljubljana. There are 2 medical associations, our ERA-EDTA and the Vascular Access Society, that are partnership in this very challenging project. And finally, we have 2 small and medium enterprises that will help us in developing new tools in nephrology that are ERA-EDTA with the e-learning platform and EMAC with the simulation tool. There will be 4 curricula for 40 young nephrologists. The residents that can apply to the project and to the program are the residents from the 1st and 2nd year. The program will last 2 years. There will be 4 curricula, 6 months per each curriculum: the REMAP, the REVAC, the REMUSE, and the REPAD pathways. So 4 curricula. The REMAP will be illustrated by Professor Jadranka Ponikvar, and actually REMAP will enhance the approach to renal biopsy by leveraging the latest advance in histopathology and molecular pathology. There will be the second module that will be better illustrated to all of you by Professor Jose Beas, that is the ReNews module, that will describe the fundamental principle of the ultrasound technique and the application of ultrasound to the main topics of nephrology. There will be Maurizio Gallieni that will illustrate the REVAC module, providing a comprehensive knowledge in vascular access management, resulting in a more effective, efficient, and safe patient treatment. And finally, Dimitrios will explain to you what the REPED module will do with the residents, focusing on providing skills in peritoneal dialysis management and surgical techniques for correct catheter placement. So the Npath pathology will use a face-to-face learning and online learning approach that will be blended together, the face-to-face plus the online learning, using modern facilities, experienced tutors, cutting-edge simulators, augmented reality tools, e-learning platform, unpublished learning material, expert live discussion, customized mobile app. At the end of the course, we will release an open access e-learning platform, and the 4 residents will receive an academic certificate with academic credits, 29 academic credits. So the Npath's goal is to make nephrology career more appealing by creating a community able to engage thousands of nephrologists worldwide. This is our brand, is the Npath. You can find all the information on the website that is www.npath.eu. And if you get inside of the website, there is, the path that you can follow to apply for the Npath project and program. You will find all the information clicking in the website, and you will be directed to the website where to apply for the nephrology partnership for advancing technology in care. Npath, as I told you, will be a European course with academic credits. You will find the application submission has been opened up on May 26 and will be closed down on June 20. So please apply, and thank you very much for the attention. And now it's time that we go on with the 4 curricula. So I am, leaving the stage to Jadranka. Professor Pongnikvar from Ljubljana will present you how the REMAP module has been built up. Thank you, Jadranka, to be with us.
Ladies and gentlemen, dear colleagues, I'm glad and honored to be here and to present you in brief Npath Module 1, Renal Expert in Molecular Pathology. So, our goal during this course is to train our young hands-on training on biopsy of native and transplanted kidneys will be organized in 4 hospitals. This will be Bari Hospital, Sacco Hospital, University Medical Center Ljubljana, and General University Hospital in Prague. And each of these hospitals will host 10 trainees for 4 days. And digital pathology seminar, which will last 3 days, will be organized by Amsterdam University Medical Center, and they will host all 40 trainees. So, as concerns hands-on training, The topics will be theory recapitulation, operating room with a real patient under tutor guidance, augmented reality simulator. This is cutting-edge education technology which will be introduced during this course. We will use renal biopsy execution on a mannequin. We will also use analysis with microscope of kidney samples, and we will also discuss real patients and then possible complications after renal biopsy. During hands-on training, the attendees will be present in the hospital from 9 a.m. to 5 p.m. and on the day first they will become familiar with the basic theory, best practice analysis, and on the afternoon they will analyze with tutor video recorded procedures. And during day 2 they will work with virtual reality simulator, and on the afternoon they will explore position for puncturing left or right kidney, and also they will become familiar with the tools we use during biopsies like guns, needle gauges. During day 3, the attendees will practice on Blue Phantom simulator, both on the morning and afternoon. And during day 4, the schedule will include renal ultrasonography follow-up of the patients after biopsy to detect complications and analysis of complications clinical cases. And at the end, final test will be performed. So all training centers will use the same equipment of Blue Phantom realistic and resilient ultrasound training model with the kidney, and all centers will use renal biopsy training by virtual reality, which will enable our attendees to understand three-dimensional reality when puncturing a lower pole of usually left and sometimes right kidney. And this understanding is crucial because three-dimensional picture cannot be obtained by standard ultrasonography. So, from my personal experience in more than 30 years performing kidney biopsies and renal vascular Doppler ultrasonography, I may say that today renal biopsies are performed in more complex and demanding patients than ever before. We perform biopsies in very elderly patients with many comorbidities, with limited cooperation, with anti-thrombotic treatment necessary for the comorbidity, and sometimes we cannot stop this treatment during biopsy because of vital indication. We perform biopsy on patients with acute and chronic kidney disease, on solitary kidneys, in kidneys with multiple cysts. They may be on the needle path. So safety is priority. And this demands expertise in renal Doppler ultrasonography. This demands good equipment and instruments, and demands Doppler control for active bleeding and later complication. We perform many times after biopsy. And to improve safety and recording of our procedure, the attendees at our institution and other will become familiar with the local clinical path, with the checklist, and this local used checklist will be translated to English. So it is very useful and maybe essential to have real-time microscopic evaluation of sample quality during biopsy procedure. And in our hospital, a sample is evaluated after each needle pass. And if active bleeding is observed after first needle pass, operator discusses sample quality and decides whether to proceed or not with the biopsy procedure. And this sample is insufficient if molecular diagnostics is planned. Further procedure is adjusted, like another tissue core or changing the needle gauge, etc. So, welcome to EMAP, Npath Module 1. Welcome to Slovenia, and let's bring together renal biopsy back to nephrology. I strongly believe that no one can do it better than nephrologists. Thank you for your attention.
Thank you, Professor Ponikvar. This was a very comprehensive presentation of the REMAP module. Now it's time for the REVAC module that is on vascular access, and it will be summarized and presented by Professor Maurizio Gallieni from the University of Milan. Maurizio, it's your turn.
Thank you, Tino, and good afternoon, and thanks to all the people attending the session. I see 180 in this moment, so this is very good from our viewpoint. I am very glad to be part of this project. Professor Gesualdo already introduced very well what are the aims. I want to remember, if you want to concentrate on vascular access, which is the topic of the REVAC module, that will start in January 2022, that we all know that vascular access is considered the Achilles heel of hemodialysis. That's not a chance. It is actually every time we have a problem with vascular access in nephrology and dialysis, we are all very concerned because we know that without a good vascular access, the patient can have complications and can even die. And so we have been asking for collaboration. So multidisciplinary teams are now in effect in many centers, but the nephrologist is still the coordinator of this multidisciplinary team. And we believe it is important that any nephrologist will have knowledge about vascular access, even if he's not an interventional nephrologist. In this paper published in 2020 by Dr. Niyar and Dr. Bithard, there is a path from past to the future on how we can think that interventional nephrology will develop. And just to enlarge part of this visual abstract, you can see that what they say in the abstract of the paper is that as we find ourselves on the threshold of a much-awaited revolution in nephrology, there is great opportunity, but also formidable challenges in the field. It is up to us to work together to realize the enormous potential of our discipline, which is nephrology, of course. A comprehensive curriculum that encompasses research from bench to bedside, coupled with standardized clinical training protocols, are fundamental to this expansion. And I think that Npath is actually addressing this issue. So we have seen before that the core aims of the Npath project is just to blend together face-to-face learning with online learning. So we will have for online learning web lectures in vascular access as well, and some training for face-to-face learning, and the blended learning is the result of the two approaches. So let's see what the lectures will be. You see there is a list, a very comprehensive list of the REVAC module web lectures. that will cover all the aspects of vascular access, from epidemiology to everything that regards catheters and AV fistulas and AV grafts and patient safety, up to the more recent procedure that have been developed, like the endovascular AV fistula, which, in my opinion, will actually become one of the standards approach to AV access construction, similarly to what happened with laparoscopic surgery compared to regular surgery. So they will be together. So it's not that they are competing, but they can interact and be used in an alternative way, especially because endovascular AV fistulae will use the deep veins, while the surgery usually superficial veins. So there is actually no competition. Let's see how this module will be developed. The hands-on training will take place in 5 centers in 2 different sessions. So there will be, for 2 times, the participants will come to one of these centers for the hands-on training. And they are, in addition to the 2 Italian centers, Milano and Bari, Patras in Greece, Maastricht in the Netherlands, and Sabadell, close to Barcelona, in Spain. And I just have a few pictures just to give you an idea of the university hospitals. This is in the foreground, the University Hospital of Patras, with this beautiful view on the back. And this is Dr. Ribea's hospital in Sabadell. And this is the University Medical Center in Maastricht. And this is my own institution at Sacco Hospital in Milan. And this is the brand new building that Professor Gesualdo opened last year, which I visited, and I was very impressed by the very high level of quality that you can find there, both for patient assistance and for clinical training. So you can recognize here Dr. Ribeas with one of his tools that he is developing, very active with his a startup company, which is very interesting in the ideas of helping simulation training. This is one of our publication, reconstruction of the left brachiocephalic vein, just to give you the technology that we are developing for a better visualization of the vascular access. And some more pictures here. This is another 3D reconstruction of real patients that is illustrating for didactic purposes all the different anatomic levels. This is a hands-on training session in my own university, just to show you that we are already doing what will be developed during the Npath project. So what are the content of the 2 hands-on training sessions for REVEC? The first one will be vascular access basic level, 3 days, 18 hours. And the program will be developed on patient history and physical examination, including AV fistula monitoring, and then the preoperative assessment of the vessels for ultrasound mapping. And the second module will be 4 days, 24 hours, and we will have more detailed training on the anatomy and surgical dissection and AV fistula construction with the simulation models, and importantly, catheter placement, which I think all nephrologists should be able to do independently. And also there will be attention to vascular access complication, both for AV access and for catheters. So finally, I want to underline the potential impact of this Npath exchange educational program among the nephrology community. It's not only the 40 people that will participate that will benefit. This is a starting point to enlarge this experience to many universities in Europe. At least this is our hope. Npath will deliver a clinical exchange experience to the process of transformative learning. And although the learning program will be the same for all participants during the hands-on training session, they will be immersed in cultural system different from their own. I think that is also the importance of sending the participants from one country to another. So there will be a gain on an increased global perspective and an enhancement of their clinical and cultural competency. And I think this was my last slide. This is again the participants of the consortium, and these photographs that I took during the lockdown in Milan, I think will just give you an idea of what we want to do here, just this powerful image of men and women trying to go back to a real life. Thank you for your attention.
Thank you, Maurizio. Thank you very much for your presentation of the REVAC module. And now it's time to present the reuse module, the renal ultrasound module, that will be presented by Professor José Ibeas from Barcelona. José, it's your turn.
We are going to present now the REMUS program, the renal expert in medical ultrasound module. I'm José Beas from Puerto Rico University Hospital from Barcelona, Spain. This module is scheduled for the second half of the next year, from July to December of 2022. We are going to use the most modern technologies for the theoretical concepts with distance e-learning, and on the field of practice we are going to do intensive training days. This means we are going to create small groups in order that all the students can cutting-edge simulation sessions. For the centers included in this module are University of Aldo, Bari, a hospital, Puerto Rico University Hospital in Barcelona, the University Hospital of Prague, and the University Hospital of Ljubljana, with the support of the ERA-EDTA, the Vascular Society, and two important companies with a lot of experience in e-learning and simulation models. Well, here we have all the details of the different centers with the main issue related with their practice, with the teachers, and with the infrastructure in order to be able to give the opportunity to all the students to enjoy of these different centers. Well, which are the topics we are going to review? The nephrologist needs to know all related with hemodynamics. That means to know how to use the ultrasound in thoracic examination, lung, and mainly all related issues with hydration, inferior cava vein, and so on. All related with kidney and urinary tract pathology. All related with the secondary hyperparathyroidism examination. That means how to examine the parathyroid glands. And all related with vascular vessels. That means how to examine the supraortic trunks, the upper limb, renal vessels, abdominal aorta, and lower limb. That means all related with the vascular access, in order to know how should be placed a catheter, what about the mapping, what about the fistula, what about the arterial vessels of aorta, lower limb, and so on, and mainly all related with the renal vessels. And all related with the peritoneal dialysis catheter placement and the evaluation of the catheter situation. Well, for this, we know how to use the ultrasound. We need to know all the characteristics of the probe, of the different settings of the machine, and to be familiar or all related with the use of this device. And the second point is how to interpret or related with the V mode, the hemodynamics of the color Doppler, and the main concept related with the spectral Doppler. That is the more important issue for the nephrologist. For instance, here you can see the image or the renal artery or the vessel related with the vascular access. For nephrologists, the interpretation of hemodynamics is crucial. For this, we should know how it works. For this, our main aim is to show to the students how it works, ultrasound examination in all these different pathologies in patients like this. That means examination in the neck, in the thorax, in the abdominal cavity, in vessels, and so on, and in simulation models. We are going to use different kinds of simulation models, like synthetic simulation models or virtual reality simulation models like this one. I would like to show you how it works. We are going to do the approach to the neck in order to examine the jugular vein and the carotid artery with ultrasound. Here we can see how the probe should be placed in order to discover the anatomy of this part of the neck, crucial for the catheter placement for the nephrologist. And this is the approach with the needle. Here you can see how should be placed the needle in relation to the probe and the ultrasound beam. Can you see here the tip of the needle? This way you can learn how to use your hands to the best match of the probe in relation to the needle in the field of the vascular access in the neck. Or for instance, why not to use these models for the kidney biopsy? Here in 3D you can see how are placed the kidneys in relation with the abdominal cavity, and there is an approach to use the probe in order to discover the anatomy of the kidney. Here, for instance, first we can make the approach in transversal way. Here you can see the kidney, and also move the hand in longitudinal way in order to see the size and the characteristics of the kidney. Once we discover the placement of the kidney, we can use the needle. We change the probe of hand, we use the needle, and here we can learn how should be the approach, the best approach of the needle to make a kidney biopsy with a lower level of complications, as you can see here. Well, then the key points of this training program is that the hospital involved, as you can see, previously was the 4 big hospitals. It will be held in the second semester 2022, and the main point is that the aim of this module is to promote the learning of the main ultrasound and color Doppler concepts, analyzing all the aspects concerning the application in diagnostic paths and interventional procedures in the nephrology field. Well, the workload is based in contact hours, practical work, take-home assessments, self-study, tutoring, and the examinations. Well, the impact of this program, as the other ones, is that in short-term results, we would like that you acquire the new skills in advanced ultrasound techniques. The improvement of employability, this is probably one of the main aims for you, and the cooperation between academia and industry. And the long-term outcomes are, the first one, the activation of a new multidisciplinary curricula, sure the improvement of the nephrology community, to be a generator of high-profile human resources, and the competitiveness of the European healthcare sector. And why not the cooperation between the academy and industry? Well, for the implementation, we are going to do first the frontal lectures. That means to divide this in 2 levels, basic and advanced. In basic, we are going to review related with the physical principles of ultrasound you have seen previously. The semiotic of analysis of artifact, the principles of color Doppler, ultrasound instruments, transducers, terminology, ultrasound anatomy of kidney and urinary tract, or related with the medical disease of the kidney, pelvic ureteric dilation, and nephrolithiasis and thoracic ultrasound. Well, if we go deeper, we can see in the second level advanced part of this program, we are going to review related with ultrasound in acute and chronic kidney failure, related with the pathology of the kidney. That means renal cystic disorders, ultrasound features of kidney transplant complications, and ultrasound guide renal biopsy. On the other hand, we are going to review ultrasound assessment of hydration status in dialysis patients. Also, the assessment of supraaortic trunks and lower extremity arteries, abdominal aorta and its branches, assessment of renal artery, the central catheter placement all related with its approach, preparative mapping of upper extremity vessels, arteriovenous fistula for hemodialysis and its complications, peritoneal dialysis catheter placement all related with examination of the abdominal wall and so on, thyroid and parathyroid ultrasound anatomy and many diseases, ultrasound in pediatric nephrology, and ultrasound evaluation in solid renal and urinary tract masses. Well, regarding the implementation of hands-on training in the basic and advanced parts of the program, we are going to give the opportunity to the trainees to enjoy 3 days of intensive training in these techniques, with a maximum of 7 hours per trainer distributed by the different centers in the previous scheduled time. We are going to prepare the intensive review of all these different parts of the ultrasound examination with this kind of different training models. This means in order to show how it works in patients, in motion models, and so on. Well, in relation with the implementation of the learning mobility workflow, I wanted to highlight these programs in the basic and advanced one. The different centers involved are going to host the learners of the different countries. In this way, the students are going to be distributed by the different centers with the aim of to complete all the different contents of the different modules. Well, following the criteria of the European Commission for this kind of projects of the Erasmus+, we are going to make an evaluation of any of the different steps of this program, the training course or the hands-on training part, in order to review how it works the different centers, the different teachers, the different infrastructure of the different hospitals, in order to have the capability to give to the students the better quality in the training program. Well, these are the different topics in order to end these presentations. We are going to enjoy different web lectures of the main experts in Europe in all the different topics that we have previously reviewed. And also in the hands-on training in the different centers involved, we are going to have the opportunity to enjoy the experience of the main experts of all different fields in this multidisciplinary program with the nephrologists, vascular surgeons, interventional radiologists, and why not even nurses that are going to show with the best experience, with their best experience, how to make the approach in the different areas of this program. Well, dear colleagues, we would like that you enjoy this program in the best way. For this reason, after the evaluation of this module with the others, we would like that you have the opportunity to apply to this fantastic program that supposes probably one of the most encouraging projects of the European Commission in the field of nephrology. Thank you very much indeed.
Thank you, Jose, for this very nice presentation and also for the clips. They were very impressed. I am sure that the resident will like it because, you know, the young generation, they know how to use that, how to use hands. Now they are looking for it, for them. So, and finally, we have the 4th module that will be presented by my friend Dimitrios Goumenos from Greece, from Patras. So Dimitrios will cover the REPED module, that is the renal expert in peritoneal dialysis. So Dimitrios, is your turn now.
Thank you very much, Mr. Chairman. Dear colleagues, ladies and gentlemen, good afternoon. Before I start my presentation, I would like to thank Professor Tino Gesualdo for this excellent initiative I really believe that this program can improve the curriculum of education of the young nephrologists, basically because it provides a lot of knowledge, knowledge, and also components of interventional nephrology that we all need. And I believe that it will help in motivating more and more people towards nephrology. That is something that we all know that it's missing nowadays. So my presentation will be the REPED, Renal Expert in Peritoneal Dialysis, which represents the fourth part of the Npath integrated course. Which is the aim and the scope of REPED? REPED, as part of Npath training course in interventional nephrology, aims in theoretical and practical training of young nephrologists to meet the needs of patients starting on PD through integrated course that includes web lectures and hands-on training. We can see in the slides that although the number of patients starting on PD is still low, there is a tendency towards increase of the number of patients on PD in developing and in developed countries over the last decade. Maybe the better education and maybe the interventional course will help in increasing the number starting on PD worldwide. Furthermore, REPED might contribute to improvement of modality education by optimizing decision support and reducing the decisional conflict. Also, selection of suitable patients to receive treatment suited to their values, expectations, and lifestyles might be better understood by this course. And this course can help towards this direction. Furthermore, REPED might contribute to flexibility to improve dialysis modality selection that offer cost-effective treatment. Finally, and most important in my opinion, it might increase further the number of patients that will start on PD as a method of renal replacement therapy. REPED is the fourth part of Npath, starting on 1st of January 2023, and focusing on providing skills in peritoneal dialysis management and surgical techniques for correct catheter placement. It will start in January 2023. It will last up to the end of July 2023. As from the previous lectures you listened, we know that 40 people will be accepted in this course, and these people will directed to four different centers that will be included in the REPED part. These centers are the university hospitals of Bari, of Maastricht, of Milan, and of Patras. And you can see in this slide the topics of the web lectures and the speakers of each one of them: anatomy and physiology of peritoneal membrane, selection of PD patient, PD treatment and prescription, automated peritoneal dialysis and teledialysis, evaluation of advocacy of peritoneal dialysis, surgical technique of PD catheter insertion, infectious complication in PD, post-operative complication of catheter placement, and long-term complications in PD. You can see that these lectures cover the whole spectrum of education in PD, theoretical and practical, and also all the complications that patients develop during their treatment with PD. Maybe more the long-term complications in PD, which restrict the number and the long-term of viability of the method long-term. 10 trainees will visit each of these 4 centers. They will remain for 4 days in each one of them, and they will be educated in preoperative mapping, in laparoscopic implantation, open surgery implantation, and percutaneous implantation, both in patients and simulators. There is a lot of hands-on training in real clinical practice for the people who are going to enter this course, not only the REPED, but the whole project of Npath, as you understood from the previous talks. Which are the advantages in common practices? Promotion of interconnectivity of different academic centers will be possible with all this interconnection. Collaboration and exchange of good practices among the nephrology community. And of course, high educational level with common content as well as methodology will be offered in blended learning, both with web lectures and hands-on training in PD. So, the call is open. people who are interested should apply now for the Npath course. You can see the website where the application can be done, as Professor Gesualdo already said. And I hope that we will have 40 people who will be educated in the first this course, and then possibly some other people will follow this initiative. Thank you very much for your attention.
Thank you very much, Dimitrios. This was a very nice presentation from you. And now it's time for a live discussion. I don't know if there are, questions among the speakers. There are a couple of questions from the floor. The first one is from Seran Tuglular, that is asking, is there a restriction in application based on the countries? Are applicants approved from outside the consortium countries? The answer is yes, is an open call, but they needed to be authorized from their university. So please follow the instruction that you will find on the website when you apply. Now, we have, some minutes, to discuss. If there are other questions from the floor, please, we are here to answer. I think that there was a question for Jadranka. Maybe you read already on the question and answer, Jadranka, regarding Gillen Anaya. You replied sending not yet. I don't know if you want to expand this answer, Jadranka.
Yes, we were discussing. Thank you. We were discussing privately. I suppose he meant a checklist including in clinical path, and it is not available yet, but it will be. We have deadline soon, completing to upload all our materials, and this will be in that. And maybe just to say something, because my introduction was missing, and I believe it is important. The renal biopsy is a fundamental invasive procedure for nephrology, and there is no nephrology without nephropathology, and there is no nephropathology without percutaneous kidney biopsy. And it was performed by nephrologists from the beginning, of 70 years ago, and actually nephrology became the special field after percutaneous biopsy was introduced. And in many countries, radiologists, it was overtaken by radiologists. And I believe it is a big value of this course to bring back this procedure in our hands.
Thank you, Professor Ponikvar. I think that it's time to act. I think that, the director of the residency program in nephrology should, stress this point. The interventional nephrology should become a core curriculum. And Npath is one of the course. This is a comprehensive course of interventional nephrology. So we hope that, it will succeed and will be the start to project nephrology in more deep in our specialty, and maybe the right way to attract residents. The numbers that we are seeing in the United States are very scaring, because residents are not applying for nephrology residency program. So we needed to ask to all of us why is, and you just highlighted one of the major problems. Radiologists are doing renal biopsy today, and vascular access are being taken by the vascular surgeon, and the CRRT approach are more in the intensive care unit. But the future is for the multidisciplinary approach. So the nephrology should be the principal player on the nephrology patient. So I think that we hope that with this course, the residents will understand, that the nephrology has an holistic approach, and it belongs to an internal and a surgical field that should improve the expertise of our resident. I don't know, Maurizio, if you agree on what I'm saying.
I totally agree. I have to say that the European situation is different from the US, because even in the past, in America, nephrology has been mainly, or in great part, a field of foreign medical graduates. If you think of the great nephrologists that we have even now, most of them were not born in the US. For example, I was in Washington University in St. Louis. Dr. Zlatopolsky came from Albertina. Dr. Salo Clark, which was the editor of Kidney International, was, I think, from Colombia. Let's say Fernando Fernenza at Mayo Clinic. So now that it's more difficult for doctors to go to the US, I think the consequence is the fact that there are less fellows in specialties like nephrology, where Americans always were not very happy, because basically it's not much, they don't get much money as they do from other specialties. So that's a major problem of medicine in the US. So I hope that we will not have the same problems, although we are going to have a shortage of doctors, because many people in the 50s and in the 60s will retire in the next 10 to 15 years, and there are not enough young doctors to replace them. Having said that, I wanted to go back to the suggestion of the checklist. I think it's a good idea. And it is indeed a need of many nephrologists in Europe, and maybe Npath should try to do what Jadranka already did with the renal biopsy, and we can actually propose at the end of this project a number of checklists for all the interventional nephrologist procedure, and actually that would be a good publication, only dedicated to checklists, that we can actually work together with 8 universities and propose a standard for European nephrology. I don't know if you agree with that.
100%, Maurizio. The guidelines, the checklist should be one of our major goals with this course, and I thank Jadranka that have showed to us, and we will work very hardly on it. Trying to reduce the risk management of our patient. The checklist, it's important in the risk management field. And before we close, there is the last question from the floor, that is from Dr. Wei Lang Gan. Is possible for nephro trainee outside the EU, European Union, to join Npath course during COVID pandemic? Thanks. Well, Dr. Gan, this course is for training inside the European community. But I know that the ERA-EDTA is working in the future, if the program will go very well, try, to have courses that will be open also to trainee outside EU. So we will, speak with the ERA-EDTA Council and with ERA-EDTA Parma office, trying, to better develop in the future educational program that will also be delivered to the outside nephrologists from Europe. Well, if there are not other questions, I think that has been a nice session. I would like once again thank all the speakers to have joined this session. We hope that we will receive many applications. I should say that since we open up, there have are coming many applications. This is a very good point, good starting point. So we will update you through our website. So please visit the Npath website, and you will find all the information regarding this course and how it develop in the future. So thank you once again, and I hope to see you very soon in presence. Bye. Have a good afternoon.
Thank you very much.
Bye-bye. Thanks.